All right, everyone, this is going to be Chapter 18 of our Emergency Medical Responder course, Geriatric Emergencies. So, last time we talked about pediatrics and kids. Another special population that we deal with quite often is going to be the geriatric population. It's important to remember that geriatrics are commonly defined as patients who are older than 65. We see quite a few of them. If you live in a community with a nursing home, you will most likely get called there. Just regular households, people who keep their loved ones at home, trying to take care of them there. So these are ones that we see quite a bit. Like I said, geriatric patient is a patient who is older than 65 years. This is, in 2010, there were 40.3 million people who were age 65 or older. You need to remember that the natural aging process results in a decline in the functioning of all body systems. This is going to happen to everybody regardless of how they take care of themselves. So you might have an 80-year-old who is vibrant, healthy, active, does stuff. They still have that natural aging process is still causing issues with some of their body functions. And then you could have a 50-year-old who looks like they are 80 because of stuff that they've done in their past. So just stuff to remember, all right? So it's important to remember that we don't want to prejudge the physical or mental conditions of older patients. Some of them are very quick, smart, know what's going on, and like I said, some of them are just, they've declined so much because of past abuse they've put on their body. Like I said, most emergency medical services respond to many calls involving geriatric patients. It's important that we do a full body examination on all of these patients, okay? No matter how much clothing they have on, all the blankets, they tell you they're cold, we need to make sure that they don't have anything extra going on that we need to address, okay? Two of the most socializing senses are hearing and sight, and many people experience some loss of hearing and sight as they age. Driving and walking can become hazardous. Impaired vision and confusion often contribute to mistakes in taking medications. So that can cause over-medication of something. Maybe they had some painkillers pain medication they were supposed to take. They took too much. So it's not that they were trying to, it's just that they weren't able to read the label correctly and might have taken too much. Or they forgot that they took a dose earlier and then took another dose right after it. So these are all things that we need to remember that happen with these older patients. All right. Patients who are hard of hearing or deaf. So some of these patients will require the use of a hearing aid. People with certain inner ear disorders are more prone to poor balance and falls. Communication. When we address these patients, we need to be certain that they can hear us and understand what we say. We need to identify ourselves, speak slowly and clearly. That doesn't necessarily mean loudly. It means clearly. They might be partially deaf. They might not be deaf at all. We can't assume that every older patient that we run into is completely deaf and we need to start shouting at them. If we speak slowly and clearly, they usually are able to get it. And if they can't, they will tell you that they are hard of hearing and we need to speak up. Like I said, don't shout. Ask the patient if he or she can hear you. Speak directly into the patient's ear. Maintain eye contact so they can read your lips. If you're still having difficulties communicating, maybe we need to use a paper and pencil. If these are patients who know sign language, use it if you know it. It is important to remember that patients who have hearing loss, they lose the ability to hear higher frequencies before lower ones. So males they might be able to hear a male EMS provider talking to them more than a female. Doesn't mean that they just because of the pitch of their voice. Okay. Here's some easy examples of sign language. The top left is going to be sick, so it's kind of asking if you're sick. Top right is asking if they're hurt, and the bottom one is asking about help. Can you help them? There may be some signs indicating visual impairment. So are there eyeglasses laying around? Is there a cane with a white cane with a red tip sitting by the front door or by their recliner? Is there a service dog on scene? These are the kinds of things that we need to look at as we walk into the room, and we can kind of get a better idea of what's going on with the patient. This is all part of our scene size up. So a visually impaired patient may feel vulnerable during an emergency scene. You need to tell the patient what is happening. Imagine if you weren't able to see and people started jostling you around, moving you, doing stuff. You need to talk to them, let them know what's going on. Ask them if you can touch them. Always make sure that you're communicating with your patient. Find out the patient's name and use it. We should do this with all patients. We need to provide emotional support and keep the eyeglasses with the patient if possible. Don't imagine if you couldn't see and you wore glasses and all of a sudden somebody took your glasses. It's very stressful for them. We need to make sure that we keep the eyeglasses with them. So some techniques for communicating with older patients. We're going to identify ourselves like we should with all patients. We're going to look directly at the patient. Speak slowly and distinctly. Remember, that doesn't mean loudly. Explain what you're going to do in clear, simple language. Don't give them a bunch of medical terminology that they might not understand. And also listen to the patient. A lot of times these patients tell people stuff and they feel like nobody's listening to them. Nobody's trying to help their chief complaint, their big concern. Listen to them. Try and help them with what's going on. We should always show respect to our patients. Don't talk about the patient in front of them. If we find that there might be an issue that's sensitive, don't talk about it right in front of them. If you're talking to their caregiver, family member, whoever, have a private conversation with somebody about that. And also be patient. They're older. Sometimes they're slower. Sometimes they're right on the ball and they're able to talk to you very well. But sometimes you need to be patient. Let them explain what's going on. Find out what's going on. Okay? So as a person ages, several changes occur in the musculoskeletal system. We know that muscles lose strength. Those discs between the vertebrae become narrow, which cause loss of height, possible curvature of the spine, loss of flexibility. Bones in the skeletal system start to lose strength, and this all contributes to these older people experiencing some loss of balance. One of the diseases that can affect that bone and skeletal system is going to be osteoporosis. It's seen more in women than men, but it's a decrease in the density of bone. It does affect both men and women. A lot of times you see it more in females than men. So all of those changes we talked about result in an increased incidence of falls among older people. These falls result in an increased risk for brain injuries because those blood vessels are more fragile. The brain gets smaller as a person ages. So we have combined with they're not able to catch themselves when they fall. They might fall flat on their face and not even reach out to try and stop themselves. So we have to remember that there is that increased risk for injuries to the brain. As they age, they also get slower. Lend a helping hand or supporting arm when we're attempting to move them, help them out of their chair, whatever we're doing with them, and then allow them enough time to move safely. Don't try rushing them. You know, you're called to the scene to help these patients. It's not going to hurt you to be there for a couple more minutes to help them get there in their own pace. All right. Fractures, these occur frequently in the geriatric population because the loss of bone density often results in osteoporosis, like we talked about. Fractures of the wrist, spine, and hip are practically common. Geriatric patients may also have a reduced awareness of pain. So they might have fallen, broken something, but because of things going on with their body, they might not even realize it. And they might not realize the seriousness of their injury. So hip fractures are a common result of osteoporosis from falls. Occur most frequently in older women. The injured leg is usually, but not always, shortened in relation to the other leg, and then the toes of that injured leg are externally rotated. We need to splint these patients, splint that leg in the position found, and then get them transported. Okay? So here's a list of conditions that may occur with age. We might have some hearing loss, impairment, sight loss or impairment, loss of sensation. So like we talked about with those patients that fall, fracture an arm or leg, don't even realize it. Physical movements are going to be slowed. They are going to fracture bones more easily. Senility, they're going to lose some of their cognizant function. And they might have a loss of bowel or bladder control. So we need to just remember that all these things happen as we age. So in addition to all that, they're going to have more medical conditions. They're generally less able to fight off disease. Their immune system becomes less effective, not able to cough as effectively. They also have increased difficulty handling secretions that might build up in their mouth, so they have difficulty swallowing, getting rid of that stuff. There's two types of medical conditions which cause the greatest number of deaths, and these are going to be cardiovascular disease and respiratory disease, which we'll talk about now. Cardiovascular diseases are conditions that affect the heart and blood vessels. As a person ages, the body loses its ability to speed up heart contractions, and the blood vessels become stiffer and narrowed by fatty deposits. These changes are going to increase the occurrence of heart attacks, angina, congestive heart failure. Strokes and abdominal aortic aneurysms are also two common conditions related to problems with the blood vessels. Geriatric patients may not have the classic signs and symptoms of these conditions if we saw it with somebody younger. Because remember, they have a decreased awareness or sensation to the pain, and we need to treat. So that means that we need to treat these older patients with a higher degree of suspicion. With respiratory diseases, as a person ages, those alveoli lose some of their elasticity. Muscles associated with respirations become weaker. Two of the major types of respiratory disease we might see are going to be chronic respiratory diseases and acute respiratory diseases. Chronic diseases are going to include COPD, emphysema, CHF, those kinds of things. Acute respiratory diseases, we'll see like pneumonia, stuff like that. These patients with chronic obstructive pulmonary disease may live with this condition for many years. A cold or other respiratory infection can easily result in a medical emergency. An acute respiratory disease strikes quickly. Pneumonia is very common in older patients, and a physician should examine an older patient who has congestion and a possible fever. So if they're hacking up colored sputum and running a fever, it's a good chance they might have pneumonia. Need to get examined by a physician. Our treatment is going to be carefully examine the patient, get an accurate medical history, past and present, treat any symptoms, and then arrange for transport. Cancers are going to strike any part of the body. Patients do not usually call EMS for cancer. Nobody calls saying, I believe I have liver cancer. What they call for are the complications that result from cancer. So acute pain, shortness of breath, shock, other medical conditions. These patients are going to require support and then transport to a medical facility. So our older patients are quite often altered. Some of the common causes of decreased responsiveness in older patients are going to be lack of adequate oxygen to the brain, low blood glucose levels, or hypothermia. We need to assess these patients, provide transport according to the signs and symptoms you note. Remember that when we're talking about altered mental status, we need to get a good idea of what the patient's baseline. Where are they normally? What would they normally remember or not remember? Would they know the day of the week? Would they know who the president is? We have to get a good idea of what their normal is. Okay? So along with all these medical conditions they have, they might take a large amount of medications. They may see several doctors for different conditions. Those doctors might not talk to each other. They might not communicate with each other. They could have one doctor on one side of the town, one doctor in a completely different city, different medical services, so they might not be talking to each other. The medications that they get prescribed by each of those doctors might interfere with the other one or cause some other adverse side effect. They also might not take their medications as instructed. They start having some Alzheimer's, some decreased memory. They might double up on their meds. They might forget to completely take their meds. So we need to get an idea of what they take. Have they been taking it as prescribed? So like I said, determine what types of medication they take. If the patient is being transported, this says bring the medications to the hospital. So this would be up to the discretion of whoever's transporting the patient. Personally, I don't like transporting medications because they can get lost, they can get stolen. If I can get a list of those medications, that seems better for me. Okay. Also, if you bring all the medications, that means you're looking for, these patients have pill boxes where they know what they're supposed to take in the morning and night and what day. So you got to take those with you as well, and then you have to count everything that's in the pill box, match it up with what's supposed to be in the bottle. So it can be a hassle. If we are suspecting a medical or a medication reaction, we do need to get good, accurate counts of what's in there, though. So, infections and sepsis. Infectious diseases are illnesses that are caused by bacteria, virus, or fungi. Many affect different body systems or different organs of the body. Remember that older people have weakened immune systems. The signs and symptoms may vary, but common signs and symptoms include fever and fatigue, coughing, muscle aches, diarrhea. Sepsis is a severe, potentially life-threatening complication of infection. occurs when chemicals from those infections are released into the bloodstream as a result. It'll trigger an inflammatory response throughout the body. It's most common in older adults and people who have weakened immune systems. This can progress into septic shock and death. So people with pneumonia, people who are bedridden and get bed sores are particularly prone to sepsis. Got to keep an eye out for this kind of stuff. And if there's any suspicion, if the patient shows any signs or symptoms of infection, they need to be evaluated by a physician to rule out the possibility of an infection or sepsis. All right. Patients who require long-term care. So many patients with chronic conditions are now treated at home by nurses, family members. There's a variety of complex medical devices that are used with these patients, include ventilators, oxygen enrichment devices, surgically inserted breathing tubes, monitors, whole list of stuff. Patients with certain heart conditions may have pacemakers or automatic defibrillators. There might be tubes placed in the patient's arm, neck, or stomach to provide fluids or food, or maybe it's for dialysis. The patients might have catheters to drain urine from the patient's bladder. A lot of these patients often take a wide variety of medications. Here's some, you can see here, we got somebody on a ventilator, somebody else with a possible feeding tube. I don't know exactly what that is. Remember, as an emergency medical responder, we're there to assess the immediate problem, take any appropriate steps in providing care. Don't get overwhelmed or distracted by all this stuff, all these pieces of equipment. Usually we can question the patient and caregivers. They can give us an idea of how stuff works or what's supposed to be going on. A lot of times we get calls to homes for new patients of this equipment, and so they might not know exactly what's going on, but they can give you an idea of what the hospital or nursing people that come out and help set it up. There also might be directions that we can read. In most of these situations, we just need to stabilize the patient until we can get more highly trained EMS personnel on scene. So just like younger people, older people have mental health issues as well. The most common psychiatric condition experienced by adults is going to be depression. Rates of depression rise significantly with the loss of independence. So, I mean, if you can imagine, if you start having to rely on somebody to help take care of you, to get you to the bathroom, this is going to cause issues. This is going to cause problems. It's going to cause you to feel like you don't have anything left to live for. So the depression starts to rise. Depression is more common in women than men. Some of the contributing factors include living in nursing homes or living alone, loss of a spouse or close friend, declining health, chronic health conditions, terminal illnesses. So we need to be alert for signs and symptoms of persistent feelings of sadness or despair. If we observe these signs, we need to bring them to the attention of other EMS providers or other medical professionals. Suicide. Older men have the highest suicide rate of any age group in the United States. This is generally because these older people choose a more lethal means, resulting in more deaths from suicide in this group. So while our younger people who attempt suicide, some of them are just looking for attention, older people are pretty much done with it and choose a more lethal means, which, like it says, results in more death from suicide in this group. Factors that contribute to this problem include physical illness, especially terminal ones, loss of loved ones, alcohol abuse. We need to listen carefully to the patient, be alert for indications of hopelessness, depression, or attempts at suicide. If we suspect patient may be considering suicide, We need to get them to see somebody who can help. Dementia, this is going to be a pattern of decline in mental function, marked by impairment in memory, and may result in decreases in reasoning, judgment, comprehension, the ability to communicate verbally. Dementia is a progressive and usually irreversible decline in mental functions. Between 20 and 40% of people older than 85 have some degree of dementia. Some causes include small strokes, hardening of the arteries, hereditary issues. Alzheimer's disease is going to be our most common type of dementia. It's a chronic degenerative disorder that attacks the brain, results in impaired memory, behavior, and thinking. In the terminal stages, patients may be unable to walk, lose control of their bowels and bladder, becoming unable to swallow. When we're caring for these patients, we need to speak clearly, use their name, let the patient know what we're doing at each step of our assessment and our treatments. We might need to rely on family members or caregivers to provide a medical history because these patients might not know. We need to use a kind and caring approach. It's not going to hurt us to be nice to these people. We need to help them out. Hospice care is a healthcare program that brings together a variety of caregivers to provide physical, emotional, spiritual, social, and economic care for patients who have terminal illnesses. So this is for people who have something and it's terminal. And they're not expected to live and they are expected to die within the next 6 months. Interdisciplinary programs provide pain relief, other supportive care. Pain relief is going to be provided through oral medications, special pain relieving patches. So if we're suspecting somebody of an overdose, along with looking and counting pills, we might need to do a full body assessment looking for pain relieving patches. Sometimes the medicine is placed in the mouth between the gum and the cheek, kind of like candy. With these patients, EMS is usually called when the patient experiences unexpected problems such as shortness of breath. Remember from earlier in the book, our advanced directives. These are documents that outline the care patients want to receive if they're not able to make their own medical decisions. They may include do not resuscitate orders. Remember, DNR is a request to withhold CPR and other life-saving measures if a patient's heart stops or he or she stops breathing. If you come across somebody and they have advanced directives, you need to make sure to follow those. Remember that it can be revoked by family, so do your best to make sure everybody's happy. Remind them that this is their family member's wish, and we know it's hard losing someone, but we would probably want our wishes observed, so we should probably do the same for our loved ones. Remember, it's important to know the regulations concerning these documents in your state. If you cannot determine whether an advance directive is valid, begin appropriate medical care and then leave the questions to the physicians. If you have something that's not signed, it's not dated, you don't know if it's necessarily for that patient, it just doesn't look like any other advance directive you've seen, go ahead and start CPR, medical care, whatever. And like it says, leave the questions up to the physicians. So, something else to do with older people, which is fairly sad, is that sometimes elders are abused because people aren't patient with them, because they require more care. So, older adults who are physically weak, mentally compromised, they have a high risk of abuse by either spouse, family members, children, friends, or other caregivers. It can be physical, sexual, emotional, or financial. Some signs and symptoms of physical abuse would include burns, bruises, trauma in the genital area if we're suspecting sexual abuse. Signs of neglect would be malnourishment. If we suspect abuse, we need to report it to the authorities. There's many community-based programs to assist in supporting geriatric patients who need, these physical assistance, nutritional support, or even emotional support. Summary. So remember that aging is a natural process, results in decline of the function of all body systems, including sensory, musculoskeletal changes. Fractures occur in older people because of loss of bone density that can lead to osteoporosis. Common medical concerns for geriatric patients include cardiovascular and respiratory diseases. 3 common causes of altered mental status are lack of adequate oxygen to the brain, low blood glucose levels, and hypothermia. We need to not overlook the signs of mental health problems in older patients. 3 types that are seen frequently in older people are depression, suicide, and dementia. Elder abuse may take the form of physical, sexual, emotional, or financial abuse, or neglect. Quick review. When caring for an older patient who is hearing impaired, you should speak very loudly to be sure the patient can hear you. Speak directly into the patient's ear or maintain eye contact with lip readers. Assume the patient can read lips. Do not attempt to communicate because it will only frustrate the patient. Well, obviously we have to communicate with our patient. We can't assume that all patients who are hearing impaired can read lips. And like I said, we don't want to speak very loudly. They might not be able to hear you even if you're screaming at them. So we want to speak directly into their ear or maintain eye contact for those ones that can read lips. There you go. All right. Fractures occur frequently in the geriatric population due to a condition that weakens bones known as, syncope would be fainting. Dementia is a mental condition. Dislocation, well, that's not a disease. The one here that's a disease, it's a condition that weakens bones, we know is osteoporosis. Which of the following statements regarding suicide in older adults is most accurate? So older women have the highest suicide rate. Most older people seek counseling when they become depressed. Older patients tend to use more lethal means than younger patients. Alcohol abuse is not a contributing factor. So when we talked about it, we remember that it was older women have a higher rate of depression and older men have a higher rate of suicide. Most older people don't seek counseling. A lot of them either can't get to it, they don't have meat access, whatever. Alcohol abuse is a contributing factor, and it's also important to remember that older patients use a more lethal means. There you go. All right, guys, that was chapter 18 of our emergency medical responder course. That's it.